What we'll talk about today is sleep and how it affects arrhythmias. So sleep and arrhythmias. So arrhythmias include any abnormal beating of the heart. So anything from atrial fibrillation, which increases your risk of stroke, to bradycardia, which can make you pass out, to some that are life-threatening, unfortunately be a risk for death. Just a little background, there was one study that showed if you get a poor night of sleep, then the following day, your risk of having an arrhythmia like atrial fibrillation increases by 15%. And I noticed that, arrhythmias with aging, it actually becomes harder to sleep. So with aging, increased time to fall asleep, more nighttime awakenings, and increased total time in bed. And so what this all means is that the sleep efficiency decreases as we age. And so one way that you calculate that is when we send people for a sleep study, so if they're in bed for 10 hours and then they sleep for 8 hours, then the sleep efficiency is 80%, which is actually not a good sleep efficiency. So we're going to talk about some tips that will help everyone increase their sleep efficiency. The reason why we're talking about this is because it has one of the biggest impacts on your risk of arrhythmias and your heart health. Sleep has many functions. It will improve your blood sugar levels. Even if you don't have diabetes or prediabetes, if you just are a normal person, you'll find that your blood sugar is much better when you have a good night of sleep. Your risk of heart disease, and in this case, we're talking about arrhythmias, will be much better. The common ways to approach sleep are sleep hygiene, and that's kind of like always sleeping at the same time every night. Roughly, if you can keep it within 30 minutes, only using your bed for sleep or sexual activity. Try not to eat in bed, watch TV in bed, do other things. Let's talk a little bit more, about some of the sleep hygiene things. In particular, how can sleep hygiene help you? Let's start with the temperature of the room. Humans evolved sleeping in caves, so you want a dark, cool cave. So keep it cool. So there are a couple ways you can do that. You can decrease your AC. You have a natural way of doing that. You can open the window. Another thing is you can take a warm shower before bed. So how does taking a warm shower help you fall asleep? Well, the reason why is it's actually the cooling of the core body temperature that helps you fall asleep. When you take a warm shower, what happens there is that it increases the temperature of your skin, and then it rapidly decreases the temperature. And your body notices, your brain notices that rapid decrease in temperature, and that's what helps you fall asleep. There's actually a study that showed that if you wear socks in bed, that also helps with your core temperature. What makes you fall asleep is when the core body temperature, right, the head and the torso, when these get cold, that helps you fall asleep. One way that you lose heat is through blood vessels in your hands and your feet. And when your feet and hands get cold, it'll tell your body to preserve your temperature, and your core, it will shunt less blood to your hands and feet, and then your core body temperature will stay warmer. One last thing I'll mention about temperature regulation is you may have seen these on Amazon. There are things called sleep cooling mats. And what these mats are is they're just little covers that you put on top of the mattress, and they're connected to a hose with water. And then that is connected to a little kind of furnace unit, and it pumps cold water. So this little cooling unit is powered by electricity, and then you fill it up with water every once a week or so, and then it'll pump cold water. And so you're sleeping on cold water. And that actually helps reduce your core body temperature. And it's actually pretty impressive. It does lead to you falling asleep sooner and having a deeper sleep. Let's move on to the next one. What causes nighttime awakenings? It can be either something internal, like having to wake up to pee, or it can be something external, like a sound. Let's talk about noises. So what can you do for noises to prevent noises from waking you up? The simplest one is use a sound machine or turn on a fan. White noise really does help you stay asleep because what your brain notices is changes in the background noise. If there's a constant stream of noise, your brain will stay asleep. Now, if you don't have a fan, you can also use a sound machine. These are very inexpensive, and actually most people use them for babies because they help babies sleep. And I encourage you to kind of use the lower frequency sound. And another tip is, where do you place it? Generally, you want to place it between you and the source of the noise. All right, the last thing that we'll talk about in external factors is companions. And so these are things like pets or partners. One of the best things you can do is you can try and sync your bedtime so that you both are getting in bed at the same time. So that way you're not in bed, and then someone gets in bed after you, it kind of wakes you up. There are certain mattresses that don't cause too much shifting when the other person or the pet gets in bed. Some of the memory foam mattresses. Memory foam is kind of a synthetic product that has some chemicals in it, so you can always use a latex mattress as well. But something with good shock absorption. And then the last thing that's very effective is, I don't know if you've heard of them, but they're called split king or split queen bed. Basically what it is, instead of one giant bed where two people sleep, instead what it is, it's basically two twin beds side by side. So they have their own mattresses and they have their own bed frame. These are very effective techniques for improving the quality and duration of your sleep and reducing the nighttime awakenings. Internal factors, these can be things like restless leg. In that case, you would just want to make sure that your iron level is good. Another one is nocturia, which means waking up to pee. So in that case, the best thing you can do is decrease your water intake about 6 hours before bed, 1/2 a glass. You can talk to your doctor about some supplements like black cohosh, soy milk, even hormone replacement. Those things can also be internal factors that help with sleep. The research shows that if you look at a bright light before bed, it delays your onset of sleep time by 30 minutes. But yeah, at least 30 minutes if you can. But if you wear blue light glasses or use an e-ink screen, that's a fantastic technique. The e-ink screens have no front light, or you can turn off the front light completely. And I think that's a fantastic way of stimulating your melatonin producing cells. Other things you can do is cover all the lights in your house, red tinted film. Film goes out the blue light, and wear blue light blocking glasses, like 1 hour before bedtime. In an arrhythmia group, a lot of arrhythmias are caused basically patients having too much vagal tone. There are natural ways to stimulate your vagus, perfectly meditative breathing, where you inhale through your nose, and when you exhale, the shape of your mouth is as if you're blowing through a straw. And it's a very long exhalation. Basically, if the inhalation is 4 seconds, the exhalation is to 8 seconds. And that longer exhalation phase stimulates the vagal nerve, increases the vagal tone, and helps you set you in that relaxation phase.